What's up, you guys? It's your boy Miguel, giving you your daily dose of radiation. In today's video, we are covering the top ways I've seen our fellow X-ray techs get hurt at work. Alright, so to give you context, I work at a trauma 3 ER at the nighttime. I dabble in a lot of day shift also. But the few times I've witnessed people get hurt, one of the worst ones was in CAT scan. We had one of our more veteran techs, I think she was like around 50 years old, very slim, not that big of a lady, was transferring a patient from the stretcher onto the the CAT scan table. The patient stayed. The patient was kind of bigger, probably 300 pounds-ish, hefty fella. And he said he could stand and transfer himself onto the table. She was like, okay, I'm gonna just stand right here next to you to make sure, you're okay. Because sometimes patients, once they lift up, they kind of get dizzy. So usually we'll stay there and you're kind of there like, are you okay? Can you, proceed? I've known that a bunch of times during the x-rays, you put them on the table to do some L-spines and stuff while you're moving them. Once they get up, sometimes they start getting dizzy and stuff. So that happened, and I was not there, but she was yelling for help when we came, and apparently the patient got up, said he wasn't feeling good, but he said he wanted to proceed anyways, and then just kind of stumbled onto her, or I'm not sure how, but we came in and this patient was just kind of leaning above our tech, and our tech was just on the floor getting smushed against the CAT scan table, and the patient he was passed out. She got hurt pretty bad, something with her back, and I think she ended up having surgery, something with a disc with the setback. I don't know, it was pretty bad. So always ask for help, always, even though sometimes during the morning portables, that's more of it's hard. It's just so you don't get hurt. That's why I go to the gym. I recommend anyone go to the gym, especially with our profession. It's not always someone going to be there to help you, or because of the radiation, a bunch of the nurses and stuff don't want to help, right? I always see it as an upside, because the amount of pulling, pushing, adjusting, all that deals with your body and body mechanics. I know there's a bunch of people who don't like working out, but it makes your job so much easier. I've started to work out a few years back when I started this profession, even prior to that, and I can say that it helps a lot. Even in my department, I'm not the most crazy biggest person in fitness, but I have a decent level of muscle-ish. A lot of people in the medical field don't really do anything. They just work, go home, don't really, they may run, but they're not as physically fit. So we've seen a few other people get hurt. In our department, we have our veteran tech who's been there for 35 years. Every single day complains about her knees, her wrists, her back. And over the years, I would assume your body would wear down doing the same thing over and over. Certain machines are more notorious for having a harder strain on your body. For portables, like the Siemens is harder to operate than some of the Fujis, we've noticed. And even I've worked ungodly levels of overtime, I'm talking about 26, 27 nights straight. Have noticed when it's certain portables versus other portables that are more easier on your body, even on my wrist, my forearm, my right forearm, majority of the times when I go to grab the portable and I'm kind of like this, I've noticed my forearm kind of will start hurting more. Other times I've witnessed, it's always the big people. It's always the people who be pushing the capacity, because there's a weight limit to both your board and the table, and it's always the big people that you'll see people who they'll try to transfer them to get an L-spine, and they just won't be pulling right, or they won't adjust the bed accordingly. So when they pull it, they pull out their back, they hurt something. lot of the time, it's not even, I don't think a single time I've witnessed like a patient be aggressive to anyone and hurt them like that. But it's mainly the pulling or the pushing of the board. I've seen someone who like pushed the board underneath a heavier patient to kind of do a KUB and somehow ended up like messing up the wrist. I've seen a few of our techs. This didn't even have to do with radiology. It was just doing compressions, and somehow didn't do compressions right and ended up messing up the wrist. So like, I understand that our profession, the older you get, the longer you do it, of course your body's gonna have a wear down on it, and you try to always be conscious of it and always try to work smarter, not harder. That's what I always preach on my channel. At work, I have various devices that I use to make my job way more easier than a bunch of the other techs, which I cannot share here because you can get in trouble. Well, not really in trouble, but like, I'll just make another video to make it easier. Yeah, my recommendation to anyone, there's been so many times we have a few, usually student techs will notice there'll be some who'll be like super tiny, super slim, very, very, like, they're not the most strongest, and we're like, you're gonna need a lot of help. And there's a few times I don't mind helping anyone, especially anyone in our profession, no problem. But there's other people, if you constantly ask for help moving patients, and sometimes it's understandable. Like, you'll see the person and you're like, yeah, they won't even ask me. I'm like, yeah, you're gonna need help. You're probably gonna get hurt. Like, some people, a little big, little double up, supersized Americans. Yeah, but other times they'll ask for too much help, and then it's like, you should go to the gym, help you so you don't get hurt, prevent it. I would recommend that for anyone in our profession. I know it's not a requirement, but it could literally only do you good, only good, because especially if you're just doing portables on the floor, especially at nighttime, no one's there to help you. You're there sometimes with bigger people, can't move, dead weight, and you're just trying to put your little board so you can get your picture and keep it moving. I mean, sometimes I've witnessed it. You can be like, oh, you look for a nurse, and there's no nurses. You look for anyone, there's nobody. And sometimes you have to go back to your department and go get someone. Other times you just try to figure it out. But majority of the times it's like the patients that you transfer, you move, you gotta like push the board, and it's always the big people, always the big people that get you hurt, because you're putting so much strain on your body. And I've noticed also that always roll, only lift up the patient like with the little sheets if they're like tiny. But majority of the times when we both of the techs lift on the side and push the board under, it's always harder. It's easier to get the job done, but it's always harder on your body. Like, you can kind of strain it because you can't, I don't know, maybe because you're hunched over and pulling it, you mess up your back. So it's always better to roll, which you learn that in Xray school. So always roll, adjust level of the beds, do everything you can to help you have the most smoothest transition. And you can't get hurt, because at the end of the day, this is your profession. And if you're out and you hurt, it can hurt you. I've noticed that X-ray versus CAT scan, I would say that it is slightly sometimes more easier to be CAT scan, like from a body mechanic, because all you have to do is just slide them to the table and slide them back. And that's all you have to do. Versus X-ray, all the flipping and moving and turning and going to the floor, portable. Like, I could see how if you're an older tech, how it would be more of a younger person game. I mean, obviously there's techs who just continue to do it at the older age, but I would see how it would be easier transition, easier on your body, and more money if you do the CAT scan route, which I would probably end up dabbling here in the future. just to have more money. But yeah, it's been your boy Miguel. See ya on the next one.